ဟုတ်ပါလားသူများတွေကဖိလစ်မော်လည်းဒေါက်တာဘွဲ့ရထားတာဟုတ်
Welcome to Star Aviation for alcohol and other drug awareness training. In this training, we will cover Star Aviation's management procedure of drugs and alcohol, how testing is conducted in the workplace, support and assistance services available to employees, information about the risks to aviation safety from use of alcohol and other drugs, identification and management of problematic alcohol and other drug users. Module 1. Dance Overview. This module discusses the background to alcohol and other drugs in the aviation industry, outlines Star Aviation's management procedure, and describes the CASA program. Why is alcohol and other drugs such a serious issue? In September 2002, a Piper Cherokee took off from Hamilton Island. The aircraft bank suddenly stalled and crashed. All 5 passengers and pilot died. Pilot error was identified. The post-mortem found cannabis and alcohol in pilot's system, which was considered a significant contributing factor. As a result of this tragedy, CASA has introduced legislation to manage alcohol and other drugs in the aviation industry. Steve's big night out. Steve has arrived to commence an early morning shift on the ramp after a night out celebrating a wedding. His workmates report that he smells of alcohol and seems uncoordinated. Steve's duties involve driving heavy equipment in order to load and unload the aircraft. His supervisor approaches him and agrees with their assessment. Steve is stood down, an alcohol and other drug test is arranged. The breath alcohol test shows high reading. What are some of the potential impacts on Steve? His personal safety, getting to and from work. His health may have an ongoing problem with alcohol. His family, alcohol problems may affect his family. What are some of the potential impacts on Steve's workmates? Steve is at risk of causing an incident and may injure his workmates. Steve may be difficult to work with and irritable. He may not pull his weight, placing a burden on his workmates. What are some of the potential impacts on the aircraft? Alcohol affects judgment, which could lead to an impact between equipment and the aircraft. Incidents like these lead to flight cancellations and millions of dollars worth of damage. Potential impacts on the passengers, delayed flights, passenger safety if the aircraft damage goes unnoticed. What are some of the potential impacts of this on Star Aviation? Injured employees, workers' compensation, cost of delays, equipment, aircraft damage, regulator investigations, legal ramifications, and damaged reputation. Alcohol and other drugs in the workplace. It is estimated that alcohol is implicated in up to 15% of work-related deaths in Australia. Drug use in Australia is rising and is associated with work injuries. A survey in 2007 found that 35% of Australians smoked at a level, 19% had used cannabis, and 6% had used amphetamines in the previous year. The Star Aviation Alcohol and Other Drugs program meets the CASA regulatory requirements, aims to prevent incidents from occurring, key component to ensure the health and safety of all employees and our customers. Star Aviation commits to the highest standards of safe working conditions, complies with legal obligations such as CASA regulations and OHS legislation, provides information to employees, supports those employees who may have an alcohol and other drugs problem, provides managers with the support they need to manage employees who may be affected by alcohol and other drugs in the workplace. It includes a testing program to detect and deter the misuse of alcohol and other drugs. The Star Aviation Alcohol and Other Drugs Policy. Key messages. You must not be at work with alcohol or other drugs in your system. If you take a prescribed drug or over-the-counter medication, you must ensure that you monitor your employees safely and ensure your team leader is trained. More information is available on CASA website and the Star Aviation Safety Management System. Alcohol and other drugs procedures. The Drug and Alcohol Management Plan, also known as DAN, outlines detailed procedures around alcohol and other drugs testing programs, how to manage employees with positive test results, and employees identified as having alcohol and other drugs problems, assessment, treatment, and return to work procedures. Alcohol and other drug testing. Alcohol and other drug testing is an important part of Star Aviation's management procedure of drug and alcohol. It allows Star to identify and manage the risk of employees who may be under the influence of alcohol and other drugs at work. Star Aviation and CASA run separate testing procedures. CASA testing is integrated into overall Star Aviation's alcohol and other drugs program. Take some time to read through the table that outlines the testing summary for both Star Aviation and CASA.
Adi la to na the de ne. သူတို့ဘသူတွေဘလောက်ပဲပါလေဒါသူတို့သူများတဲ့တိတ်တိတ်လေးပတ်ဆိုင်ယူထားလို့ဖြစ်
Next, we
No?
will look at the effects
Huh?
of drugs
နေ
on
လို့
your body and how long they stay in your system. Then we will look at how Star Aviation or CASA may test you for the presence of these substances in your body whilst at work. Module 2. Drug Information. This module provides the definition of drug, outlines the effects of drugs, discusses prohibited substances, and cutoff levels. What is a drug? A drug is a substance which, when taken into the body, modifies a normal or abnormal psychological process. Drugs primarily affect the user's nerves and central nervous system, that is, the brain and spinal cord. What we will cover: alcohol, opiates, cannabis, amphetamine, cocaine, and benzodiazepines. Please note, under the Customs Act, it is illegal to bring many of these substances into Australia. You are responsible for what you put into your body. Drug effects and time to clear vary from person to
အဲ့ဒါတော့
person.
သွားမှာနော်
A positive test for alcohol
အများကြီးငါစီးရဲလို့အောင်ဝေးရမှာအော်ကဲဒါခက်တော့ဘာလို့ပြရတယ်သွားမယ်ဒီပြောကြရည်
next module.
ဗါတာကြားပြီးပြီလေ
ဒီမှာလေ
ဗါလေ
ညို့မေးတယ်ဖန်တီးခဲ့ပါ
What is Star Aviation?
ပြောကြရည်ဖန်တီးငါ့နာလည်းဖတ်တယ်
You must not consume
စိတ်ကုန်နေ
alcohol.
နေနေရတယ်ဒီစိတ်
ဟို
ကုန်
မှာ
နေလို့ဖြစ်လာ
ကျန်တာထည့်ရဟာတိတိညာအလုပ်လုပ်နေ
In some circumstances,
I never
for
seen-
example, due to travel, sales promotion, a manager may authorize an employee to consume alcohol, provided that care is taken to ensure safe travel. Alcohol limits. The breath analysis must not show a reading above a certain limit. What do you think that limit is? 0.02% or greater. How many standard drinks does it take to exceed the limit of 0.02%? Only one standard drink is generally all it takes to exceed that limit. You will have a high blood alcohol.
နောက်တစ်ချက်အိမ်နဲ့လုံးနဲ့တွဲရက်ဘယ်တော့မှမနေပါနဲ့နားလေ
You have not
အဲ့ဒါမွေးတော့
ဒီမှာသိချင်လားဒီမှာအဲ့လိုနေလို့အလုပ်သမားမတင်တဲ့လို့လာတတ်တာလေအများကြီးခံတယ်နားလေ
or are
အခု
dehydrated.
ကညီကယောက်ျားလေးပေါင်းစုံလာမှာငါအိမ်မှာအမြဲနေလို့မဖြစ်ဘူးညီအပြင်မသွားပဲနေဦးမှာမဟုတ်ဘူး
Cannabis
ငါတယောက်တည်း
is
Ni
included
algo non è.
marijuana.
ခုနေဒီမှာတွေ့နေ
မဟုတ်ဘူးသိချင်လား
ရက်ကောက်လုပ်နေတယ်
ဟုတ်တယ်ပြလာလေ
How long has it
နေ
affected?
ရ
ဘာမှပြော
တော့မပြောဆိုနေတာအခုချက်တတိယလုံးပြောတာ
Long-term use can have all kind of serious and safety effects. How long can it take to leave your body? Up to 77 days. It is excreted very slowly in the body. Cannabis case study. In the late 1980s, a research program studied the effects of cannabis used by 10 experienced pilots. After 8 hours of training on a flight simulator landing exercise, each pilot was given a small amount of cannabis. After 24 hours, the pilots all believed their ability to fly was unimpaired. The pilots were asked to perform the same landing exercise. The results were alarming. All of the pilots had difficulty in aligning and landing at the center of the runway. One of the 10 crash landed off the runway. Cocaine includes crack and coke. It is an illegal substance. It is a stimulant causing inability to judge risks, unpredictability, and aggressive behavior. Ecstasy. Effects includes intense lower back pain, anxiety, nausea, headaches, and flashbacks, all of which can last for months. The brain's serotonin regulated system can be damaged. These systems control verbal recall, memory, and visual scanning. Opiates include heroin, morphine, methadone, pethidine, opium, and codeine. Opiates are very strong painkillers which depress the central nervous system. If used incorrectly, they slow down users' central nervous system activity to the point where user slips into coma and dies. Medications containing narcotic analgesics such as codeine may be detected. The use of over-the-counter drugs and prescribed medication is permitted, provided they are used and directed. Amphetamines include speed, uppers, designer drugs, ecstasy, PCP, pentamine, and ephedrine. Amphetamines are stimulants that cause effects ranging from hyperactivity to psychosis. Effects can last for a few hours to a few days. People react in different ways. Small doses in some people can produce a response similar to an overdose.
ပါမိမအိမ်မက်ဒီမင်းမကြားနေရတယ်နော်အဲ့ရမျိုးတော့လေ
အေး
တရားမှတ်တာလေ
ပါရ
ငါ့ကိုလေ
อืมအေး
အဲ့လိုလည်းမြင်ဘူးဆိုရင်ဘယ်တော့ဖြစ်တော့တာ
အေးလေ
ဟမ်တရက်ပဲထားတယ်
Ritual
ငါမြင်တာဟမ်
အေးဟုတ်တယ်
used to induce sleep or relieve anxiety. Effects can last
ဒီလည်းကြောက်သွားလို့မှတ်တာလေ
to a few days.
စေးရော
These medications affect the ability to work safely. A user must not return to work until effects of drugs have passed. Prescription drugs. If If your doctor prescribes any kind of medication, you must check that the medication will not interfere with your ability to work safely. Let your doctor know that the testing for various categories of drugs is a condition of employment. Your doctor may be able to prescribe alternative medication that will not have effect on safety. You are responsible for the medication and other substances that you consume. Over-the-counter drugs. The two categories of most concern are the pseudoephedrine found in cold and flu medications such as Codral, Sudafed, and Damazin, and the codeine often found in the painkillers. Alternatives that will return a negative test result include paracetamol for muscular and joint pain or headaches, aspirin for fever, nasal spray for congestion, and vitamin C. Detection periods, length of time in system. Alcohol breaks down 0.01% to 0.015% per hour. Opiates including heroin, 2 to 3 days. Amphetamines including ecstasy, up to 2 to 4 days to be eliminated. Cocaine, up to 3 days. Cannabis, up to 30 or 40 days. Benzodiazepines, up to 30 days. Threshold levels. Threshold levels are applied when testing for drugs in either urine or saliva. If the level of drug is below a threshold level, it is reported as negative test. If it is above, it is reported as a positive test. Threshold levels are set out in the Australian standards for both urine and saliva testing. Threshold levels are set so that inhaling passively or trace amount of drugs are excluded. Drug used within the detection period is likely to exceed the threshold level and produce a positive test result. Summary. You are responsible for what you put in your body. Effects and time to clear vary from person to person. Positive test results of drugs will have consequences.
Supplementary power.
Module 3.
Testing
Testing procedures. This module outlines details of alcohol and drug testing conducted by both Star Aviation and CASA. It defines your rights and responsibilities. Take some time to read through the table that outlines the testing summary for both Star Aviation and CASA. Who may be tested? Star Aviation employees and contractors who undertake safety-sensitive aviation activities may also be tested by CASA. CASA will perform random testing only on employees and contractors who perform safety-sensitive aviation activities. When will Star Aviation test? Prior to employment, conducting work in safety-sensitive aviation activity job, show cause, that is, where there is a reason to believe that an employee may be under the influence of alcohol and other drugs, post-incident, as part of the investigation following an incident, and follow-up testing as part of the return to safe work plan. When will CASA test? CASA will perform random testing on employees and contractors who perform a safety-sensitive aviation activity. About testing. Testing is carried out by independently trained testing agents, appointed by either Star Aviation or CASA. These approved testers are trained to follow the relevant standards for testing procedures and will treat their employees with dignity and respect. They will ensure the highest standards of privacy and confidentiality are maintained. Once you have been notified that you have been selected for testing, you are required to participate. Failure to do so may result in disciplinary action and being stood down. Under the CASA testing program, you may also incur a fine. What will happen if you're selected for testing? You will be informed by your manager or supervisor that you are to undergo a test, as well as the reason for the test, or notified directly by CASA testing personnel. You'll be given a written outline of testing procedures, and you'll also be asked to sign an authorization for testing to proceed.